10-month-old Adeleke is doing better. She was brought in by her mom for treatment. Adeshola's mother is happy that her baby received good health care free of charge.
I brought her when she was having a high temperature. Now she has been attended to free of charge.
This is 2-year-old Akinade. He was brought in this morning to get treatment for a 4-day strong typhoid fever. His father, 27-year-old Jelili Akinade, is happy that his firstborn is finally receiving good treatment.
He fell ill 4 days ago, and we took him to the big hospital in Molete, but we didn't see any changes, so we brought him here, and they are taking good care of him.
The mother brought him this morning with the history of high temperature, vomiting. Then we asked her to go for wider test, which was significant. Then we decided to admit the child.
Bolanle Jimoh is the chief matron of Boluwaje Primary Healthcare Center in Ibadan Southeast Local Government. She has been doing this for 27 years now. She said previously only 10 infants were brought in for treatment and now more than 65 are attended to monthly. She also recounts many success stories.
Delivery of this morning, spontaneous vaginal delivery, no complication. The mother is okay, the child is okay too, and it's a male child. NHIS Boluwaje Comprehensive Health Center, and I'm the matron in charge of this hospital. We do attend to the pregnant women. We treat minor ailments. We treat 0 to 5 for any of these minor ailments. And since the introduction of this program, we don't collect penny from the patients when they come for health services.
Our journey started in the year 2007. That was a time when one of our accredited health maintenance organizations by name HIGIA secured some funding from a Dutch government to give community health insurance cover to certain communities in the country. So they paid a courtesy visit to Mr. President then, Chief Olusegun Obasanjo. And in the course of our discussion, he made a declaration that part of the debt relief gains are going to be used to help in community health insurance. And it was following that we developed a concept paper to the Office of Senior Special Assistant to Mr. President on how to give cover to pregnant women and children in the country. That materialized in the year 2008 when we allocated 5 billion naira, and 6 states were selected based on geopolitical spread.
The successes have been made in some areas, and of course we've achieved successes in some other areas, particularly in the reduction of maternal mortality rate. That we have achieved a lot of successes in Nigeria. And this is as a result of the policies and programs that we have put in place, i.e. partnering with the National Primary Healthcare Development Agency, as well as other partners in Nigeria who are actually involved in improving maternal health in the country.
Getting the most vulnerable group of children and women to enjoy free healthcare is still a major challenge. Some families in rural Nigeria have poor health-seeking behavior and cling to cultural and religious beliefs while avoiding government-provided health care. The MDG's office has instituted a focused approach to rejuvenate all existing primary healthcare institutions by collaborating with governments on all levels. At the rural level, the MDG's office is carrying out a rigorous campaign against unfavorable religious and cultural beliefs that have adverse effects on accessing health facilities. Over the years, using the debt relief gains, huge investments have been made in the country's health sector as part of the effort to attain the Millennium Development Health Goal. Between 2006 and 2010, an estimated investment of about 91.46 billion naira was made in the sector through the federal ministries, departments, and agencies. Health has a major place in government's development agenda, and so various policies like the National Health Insurance and Health Investment Plans are being pursued. Reducing child mortality and improving maternal health care, however, still face grave challenges in Nigeria.
What we tried to do really is to identify what are the major causes of maternal mortality in Nigeria. That we did, particularly looking into the fact that one of the major problems that we have with maternal mortality in Nigeria is as a result of lack of taking decision on time, and delay in taking pregnant women to the hospital, and then also delays that also take place in the hospitals itself. Now, for you to reduce maternal mortality in the country, you must take each of these aspects separately and address them squarely.
Many believe that Nigeria's primary healthcare system needs to be overhauled and rejuvenated under the direction of the Millennium Development Goals. The MDG's office is providing funds to scale up the provision of primary healthcare.
The strategic health plan in the country is a very good one. It's robust, it gives a clear roadmap, and there are roles and responsibilities for everybody. It also is something that you can pick up and you can measure to see what we're doing in terms of reaching the goals that we've set for ourselves. But at the same time, it gives very clear guide to those who want to invest, because often people come into the country, where do we invest, what do we do? So it's a collective roadmap for reaching the health goals. So I think that's one very important step that the Federal Ministry of Health has taken. The second is it's reinforced its agencies. The Primary Healthcare Development Agency, the National Health Insurance Scheme have all been strengthened in terms of the human resources, the investments that are much more strategic to make at the local level, the partnerships with the traditional rulers, with the state governments, all of these have been strengthened, and I think that we need to do more, but it's in the right direction.
We can only partner with agencies of government, particularly the Federal Ministry of Works and Federal Emergency Road Maintenance Agencies, so that to make sure that rural roads are actually constructed, because once we don't have good roads, no matter what, women can go into labor and may not be able to get to the facility on time. Therefore, we have been advocating, and that is why the MDG office under Mr. President is actually an office that actually collaborates with many other agencies, ministries, departments, and agencies, and then we'll continue to advocate for the construction of more roads, particularly rural roads.
Debt relief gains are also being used to procure drugs and equipment for maternal and child health care. 120 primary healthcare centers have been constructed and equipped, while federal health institutions are constantly being refurbished. A national health policy has been developed and is being monitored for implementation.
In terms of facilities, which is one problem also that we have in those centers, we are also working hard, towards procuring equipment into those facilities. Now, this equipment, we make sure that each midwife that is deployed, we actually equip her with a set of what we call the midwifery kit. And those inside the bag of the midwifery kit is a full range of equipment that a midwife requires to safely deliver a woman.
The MDG's office is looking to ensure that by 2015, the under-5 mortality rate will be reduced by 2/3 and the maternal mortality ratio will be reduced by 3/4. The task is enormous, but the advocates are determined too. Already, the proportion of births attended by skilled health personnel have increased.